Can you determine what is your perfect diet? I'm Dr. Zubkov. I'm an integrative neurologist, and nutrition is paramount for our brain health and for our body health. So I pay a lot of attention to nutrient status of my patients and correct them as one of the ways to improve their symptoms. Every time when we talk about diet, there are a lot of named diets, but they really don't consider your metabolic uniqueness. So in my practice, I always look at metabolic profile of the patient. I basically figure out how they process their carbohydrates, how they process their fats, how they process their proteins, and what nutrients or micronutrients they are missing, so I can determine which foods they will benefit from and which foods they probably need to be eating less. But also, so this is what we'll add to their food, but also we need to figure out what we need to remove from their food. And by doing so, we'll figure out what other foods we may not introduce in their diet. And this is a special test. It's called ELISA LRA test. And I'll show you in this example a sample of one of my patients that came with these findings. As you can see, this particular patient is intolerant to eggs, to lactoglobulins, and also to gluten. By the way, true intolerance to gluten is very rare according to this test, and that's what I'm seeing in my practice. But you can imagine that this patient will have a hard time finding a high protein breakfast, for example, because he cannot eat eggs, he cannot eat dairy. Also, on more detailed view, you can see that a lot of dairy products are completely excluded, including whey protein, and also a lot of grains are excluded, including all the healthier grains. So it's very important for us to really know that, because in these cases, we can basically tell him, well, you need to eat more animal protein or more fish or more vegetables rather than relying on cottage cheeses or yogurts or any eggs or egg products. So it's very important to know what patient needs and what patient does not need and what we need to remove from their diet before introducing them to their personalized diet. Follow me for more and share with us.